Today, we have invited our Associate Professor of Engineering and Science at Adolfo Ibáñez University in Chile and collaborator researcher at the National Chilean Center for AI to join us for a January AI Experts webinar. Dr. Romina Torres will explain the components of a hypothetical system for supporting clinical in the area of mental health. She'll help us identify what the potential dangers are and what we should be aware of. So she is exceptionally talented and exceptionally accomplished. We will share her LinkedIn profile so you can continue to follow her work even beyond this session. So that said, Romina, we are so excited to have you with us today. Thank you for joining us. I will turn off my video and my audio to give you space to share your slides, and I'll let you take it from there.
Okay, thank you very much for the nice introduction. So I'm going to share my slides and just give me 1 second. So I think right now you are seeing my slides, right?
Yes.
Okay, thank you. Well, thank you very much for the invitation. It's very exciting to be here with this great association. So, as you said before, my name is Romina Torres. I'm a computer engineer, and I'm living in Chile, and also I'm working as associate professor of the Adolfo Ibáñez University. So, I will start this talk saying that, well, as you know, depression is the leading cause of suicide among young adults. It's not just a feeling sad for a while, it's a serious medical condition that can last weeks, months, or even years, affecting daily life and, of course, the emotions. So sometimes the person who sees fine maybe silent struggling, sleepless night, and So take Anna for example. She had a normal life, and one day she broke down and sought help. And she went to the hospital, and the doctor saw her, spoke to her, and decided she was just fine. So they sent her home. Yet, well, she felt more hopeless than ever, and soon after, she made a heartbreaking decision. So, Anna's story is not unique. Every year, 700,000 people die by suicide. Many suffer in silence, afraid to ask for help. Depression is actually a recognized mental illness. It is treatable, of course, with therapy, medication, and social support. Well, this talk is about how technology can be a powerful tool for mental health support, but also how, without the right care, it can make things worse. So I will try to explain about that. um, so now let's talk about another major challenge, the lack of mental health professional that is a typically a problem in the medical side, right? So imagine being in a stadium like the one is in this image, and thousands of people all facing one single professional for help. That's the reality for mental health care today. On average, there are almost 4 psychiatrists per 1,000 people worldwide. So that means that in many places, getting mental health support is nearly impossible. So at the same time, 1 in 8 people, almost 1,000 million worldwide, live with a mental health disorder. So depression and anxiety are the most common, but access to treatment is extremely limited. The truth is there are simply not enough mental health professionals to meet the growing demand. As a result, many people don't get the help they need, either because they can't afford it or because there is no one available to support them. So Anna's case highlights one of the biggest challenges in treating depression or this kind of mental illness, the lack of clear biomarkers. So if you compare this kind of illness with diabetes, for instance, when treating diabetics, doctors have a specific test to measure blood sugar levels and adjust treatment accordingly, right? But with depression and all this kind of illness, we don't have a simple test to determine who's struggling, how severe it is, or which treatment will work best. So what happens is, so maybe in some time doctors must often rely on trial and error, testing different medication and therapies over weeks, months, or even years to find what works. So quite complicated for the persons. So summarizing, mental disorders are increasingly common. Anxiety disorders affect over 300 million people, while depression impacts almost 300 million people more, including millions of children and adolescents. So, despite this, treatment is not always accessible. Effective treatment exists, psychological therapy, medication, but getting the right treatment at the right time is another challenge. Depression is not a single condition, it has multiple subtypes, as you can see in this chart. Each responds differently to treatment without clear biomarkers. Doctor must often guess the best approach, adjusting medication and therapies over time. So actually, this can take months or even years. So the problem, some patients feel worse before they feel better, if they ever do. So that's it's a big problem beyond the access. There's another challenge, stigma. Many people with mental health conditions experience discrimination or even human rights violation, making even harder to seek help. So we know the challenges. Depression lacks clear biomarkers. Treatment is often trial and error, and millions of people don't get the care they need. So can technology help us to fix this? That's the question, right? So the answer is probably yes. Yes, but only if we use it responsibly. AI-assisted mental health platform can transform how we diagnose, treat, and support individuals. Instead of relying only on traditional methods, this system integrates data-driven psychological intervention models to provide more precise, timely, and personalized support. So here's how AI can help. AI can analyze speech, text, behavior, and even wearable data to identify early signs of distress. It can also break down therapy sessions into patterns, helping professionals understand what works best for each person. So also, instead of one size fits all approach, AI can tailor recommendations based on individual history and real-time data, providing immediate feedback during therapy, both in person and also remote. These systems, of course, do not work in isolation. They integrate with existing healthcare tools while ensuring privacy and security, the most important part, at least for me, which is essential when dealing with sensitive mental health data. And also, AI can also help us to notify therapists or support network when a patient is at risk and provide training also for both professional and users to ensure effective adoptions. So we have talked about how AI can enhance mental health care, making more accessible and personalized. But how that does this work in practice? Let's look at some real world solutions. Is not an exhaustive list, of course. For instance, you have chatbots that provide cognitive behavioral therapy techniques, helping users with emotional support and guide interventions. Ginger, an on-demand mental health service that combines AI with human therapists, that is very important, the human in the loop, offering text-based coaching and video therapy. Uber, an AI-powered app that tracks mood and emotions, adapting interventions to the user behavior over time, and others using smartphone data to detect early signs of depression and provide continuous mental health monitoring. So these tools are already making a difference. For instance, remote therapy services powered by AI have provided over 250,000 hours of therapy entirely online. In some cases, they are being used in school and in universities to support younger population, and that is quite important, especially for those that we are mom. So, but while this technology increase accessibility, they also raise important ethical questions. How do we ensure AI does not misdiagnose? How do we prevent bias? So AI in mental health is promising, actually, but it's not perfect. So let's explore some risks and challenges that come with these technologies. So here, sorry, but I'm a computer engineer, so and also a software architect. So I always try to show what is behind the curtains, right? Because inside of the black box. So in the case of AI-assisted mental health platform, data-driven psychological intervention system, right? That's a big statement, but what does it really mean? What's behind these AI-driven solutions? And more importantly, how do they actually help people? As a software architect, I tend to see things in terms of system and structures or components. I know this diagram might look complex, but I want to show you what happened behind the scene when AI is used in mental health care. Let's take our real world example and see how data-driven psychological intervention can make a difference. So let's imagine Anna, someone is struggling with depression but without easy access to mental health care. So this AI assisted platform could help her in several ways. For instance, Anna starts chatting with the AI assistant. Unlike a traditional chatbot, this system uses a large language model to understand emotions and provide empathetic structured responses. As Anna speaks, the system doesn't just process words, it detects emotional patterns using another models and also the change in voice tone, helping to assess her emotional state over time. So, based on error interactions, the AI suggests therapy techniques, self help exercise, or even connect her with a human therapist. So, if the system also detects a high risk situation, it doesn't just guess, it escalates to the real healthcare professional, ensuring Anna gets the support she needs before it's too late. So this is what we mean by AI assistant platform becoming data-driven psychological intervention system. We are not replacing in none case, we are not replacing therapists, we are enhancing the reach. We are just creating copilots to support these therapists to in his action, right? So as promises as they sound, there are ethical and technical challenges we must address. For instance, in this system, privacy, bias, and reliability are quite important. So the big question remains, how do we make sure this technology actually help people like Anna? So let's discuss that right in the next slide. So, well, we could say that with great power comes great responsibility. So we've just seen how AI-driven mental health platform collects and analyze data to provide better support. But this raises an important question. How do we ensure that this data is handled ethically? So mental health data is highly sensitive. It includes emotions, behaviors, therapy sessions content, and even biometrical signals like voice, tone, and facial expression. So, if mishandled, this data could be exploited, misinterpreted, or even weaponized against users and then harm users. That is one we need to avoid. This is why ethical consideration must be at the core of AI assisted mental health system. So in this case, we need to take care about data privacy, of course. Mental health data must be protected from unauthorized access. So imagine if Anna's personal struggles were leaked or misused. This could have devastating consequences also for her, right, and for everyone. Transparency and consent. Users need to know how their data is being used and explicitly agree to it. No hidden data collection is allowed. Data minimization is also a very good principle because only we need to collect as computer science data or only collect what is necessary. More data means more risk, more responsibility. So less data means fewer chances of risks or misuse. Data integrity and accuracy. If AI makes decisions based on flawed data, the consequences can be harmful. Misdiagnosis, incorrect treatments, recommendation, or and actually loss of trust in the system. And so on, right? Data security, of course, ethical use of data, and so on. So we have talked about the importance of ethical data use in AI-driven mental health platform, but how do we assess whether these systems are truly secure, ethical, and responsible? So this is where AI threat modeling comes in. AI systems, especially in mental health, must be designed with safeguards in place. But what risk do we need to consider? For instance, this framework, because there are several in the market, open, free for use, but this framework from Plot for AI help us break down potential threats into different categories, including security, privacy, safety, bias, and compliance. So quite important when you need to protect sensitive mental health data from cyber attacks and unauthorized access, or ensuring patient that data is not misused, or preventing AI-driven decisions that could discriminate or harm users. So for us, identifying this risk before deploying AI system, we can make mental health platforms safer and more reliable. But identifying risk is not enough. We also need accountability. Okay, so far we have discussed how AI can assist in mental health and the importance of ethical data management, where security is a critical issue that must be addressed. So these kind of platforms are just software, and as any other software, they could be attacked. So imagine a ransomware. We all know what is that. A ransomware could attack and encrypt the system, rendering it useless until a ransom is paid. So, but even if we design the system responsible, a new battlefield is emerging. AI itself is vulnerable to new kind of attacks. On this slide, we see the top 10 AI vulnerabilities identified by OWASP. OWASP is an organization known for its cybersecurity research and best practices. These vulnerabilities affect both machine learning models and large language models, which are the backbone of many chatbots and AI-driven mental health tools, of course. So bad actors could manipulate training data to introduce bias, reinforcing discrimination, distorting therapy outcomes, or misleading users. Maybe, I hope no, but a competitor might poison the AI model, making it fall systematically, damaging its reputation, and more important, making harm to users and patients. So, well, first, imagine a an AI system training on therapy session data. Of course, AI model need a lot of data, right? So, if an attacker can determine whether someone's data is in the training set, it reveals that they participate in a mental health study, compromising their privacy. So, if a person participation in therapy can be inferred, it could lead to discrimination, stigma, or even legal issues in certain contexts. This should never happen, but whether it does or not depend actually of computer engineers, right? So it's our responsibility to ensure that this sensitive information remains private and protected. One of the fundamental principles in mental health is informed consent, of course. So patients trust that their data will remain confidential, but membership inference attack uh, challenge this assumption, making privacy protection even more critical. So we have to remember that membership inference attack is one of the top 10 vulnerabilities that was recognized by OWASP last year, right? One of the most dangerous because privacy is in risk, under risk. So in this case, right, I will try to break down how an attacker could exploit this vulnerability that is actually membership inference attack because we have heard that um, once the model is trained, you forget about the training data. So there's not any risk about to recover which data was trained the model. So I will try to show you here how this could be not actually always true. So let's break down how an attacker could exploit this vulnerability step by step using this sequence diagram on the slide. So the attacker here send, well, this attacker, a malicious actor, craft an input containing details similar to those of, for instance, Anna. So this is sent to the advanced analytic engine of our platform that process the request. And of course, the advanced analytic engine evaluate the input, all the characteristics of ANA, and calculate a probability score. So if ANA's data was part of the model's training set, the system might respond with a high confidence level, depression, 100% of confidence. So when an attacker receives this kind of response with a 100% of confidence, um, this score that is significantly high, it strongly suggests that Anna's data was part of the training set. So once the adversary infer that actually Anna, right, was in this training set, they record the probably membership, and in some case, this data could be sold or used maliciously by, I don't know if that's right, but could be used by some malicious party, right? So even if not, we need to take care and protect the privacy of this person. So in the other side, if you see this one, sensitive information disclosure, let's say LLM 06, that is actually a top one vulnerability, but for the um, large language model regarding chatbots, for instance. You can understand more easily like that, right? So in this case, if the adversary makes a very send a craft input and a prompt actually, and is forwarded to the chatbot system. The chatbot forward to internal components and generate a response. But if the prompt asks for extract privacy data and is not safeguard in place, maybe some data could be returned and reveal sensitive data. So that's another kind of attack if the system was not actually it was not responsible designed, right? So these kind of issues, of course, let's talk about how we can protect about these issues. So let's talk about continuous audits and monitoring approach that implies to AI system, but also to any critical technology infrastructure. So in this case, we need to regularly checking system for unusual behavior, unauthorized access, or signs of manipulations. That's the typical traditional, right? So this applies to both AI and traditional systems because detecting issues early can prevent data leaks and authorized access and, of course, model poisoning. So we need also that. But auditing and monitoring alone are not enough. What if an attacker managed to extract personal data despite our best efforts? So this is where differential privacy comes as an example, right? Because there's a lot of alternatives. So let's explore how that could help. So differential privacy. So how do we make AI model resistant to attacks like membership inference and sensitive information disclosure? So one key technique is differential privacy. But what does that actually means? So imagine an AI model training on thousands of therapy sessions. So without differential privacy, an attacker could analyze its output and determine if ANS data was in the training set. That was our example. But with differential privacy in place, the AI adds noise to the data, making it possible to tell whether an individual that data was included, while still allowing usable patterns to emerge. So instead of overwhelming the audience with jargon, we can simplify the process, saying that AI intentionally add a small amount of randomness to the data. So this ensures individual data points don't stand out while still allowing generate pattern to be learned, and limit the influence of any simple person's data on the model. So this prevents extreme outliers from revealing personal information about users like Anna. And there's a lot of frameworks that you can use, like the TensorFlow Privacy or PyTorch or Pacus. So in order to ensure the privacy is baked into the AI model during training. So differential privacy actually helps mitigating sensitive information disclosure, but does not fully resolve memory inference attacks. So maybe in that case, we can also hide the confidence in order to avoid that the attacker determine with the grade of confidence if Anna's, for instance, was part of the training set. So there's a lot of decisions that you have to make when you are designing and developing the system. So machine learning models, of course, are not perfect. We have right now this list of vulnerabilities that are proper of AI. So AI also can be fooled. And what you see here in this example of is an adversarial attack. On the left, the model correctly classified this image as a panda, and we can see that it's actually a panda. It's not a great level of confidence, but we have something. But if we add a very small imperceptible noise pattern to this image, imperceptible for us, right? The model completely changed its prediction. It now thinks it's a G-bomb with a 99.3% of confidence. So this is what we call an adversarial example. It's actually an input manipulation. It's used for in attackers that are called input manipulation because they can make a small change and intervene the system actually when it's receiving a request and change that request and obtain a totally different answer. So quite difficult to detect. So now imagine this happening in a medical AI system or a mental health chatbot. A small tweak to the input could mislead the AI aim to provide an incorrect or even harmful recommendations. So that is what we need to take care also. In the other side of the coin, you could say, on the other hand, you can also use this as a defense of the system. So, how a personal network help defense against attack? So, how do we defend AI system against this kind of attack? And one solution is to use generative adversarial network or GANs. GANs actually involve two neural networks competing against each other, a generator and a discriminator. So the generator creates a synthetic example trying to fool the discriminator, and the discriminator learns to distinguish between real and fake data, improving the system ability to detect adversarial input. So that's a great new, right? So we are using that to mitigate the one of the typical vulnerabilities of AI system. So in this manner, we can actually help on that.
Romina, I just wanted to say it's a fantastic conversation. Fantastic. We have a lot of questions. So it looks like you're on your last slide. So we'll hold off on the questions. Thank you.
Yes. So, actually, I just want to say that AI also introduced new risk. AI is only as good as the data it learns. So we have to take care about the biased data and other kind of problems. The other thing that is quite important is that equity must be a priority in AI developers. Mental health AI should serve all population, not just those with privileged access. And also, we must integrate AI as an augmented part of the mental health ecosystem and not as a replacement for human care. And I would like to finish this presentation saying that AI in mental health is not just about innovation, it's about responsibility. So if we get this right, AI can be a powerful ally in mental health care. But if it's on us to ensure it is safe, ethical, and truly beneficial for those who we need it most. So thank you very much for your time.